Hi, we're going to run through the RO21 June 2019 paper so that we can unpick the questions and have a look at how we would answer those should they be on our exam in January. So as before, we've got our front cover page, which again we need to just pay attention to a few bits. So the paper is out of 60 marks. There are 12 pages. Make sure that you have accessed all 12 pages and that you haven't ended up with 2 pages that are stuck together. On your desk there will be a card that will give you our centre number 37104 and your candidate number, which you will write onto the front cover. Alongside that you should put your first name, and that needs to be your legal name. So if you go by a slightly different name, check your exam timetable. That will tell you what name we've entered you as, and your surname. Okay, admin complete. Have a quick read through. It says please use black ink. I've just been naughty and used blue. Answer all the questions, read the questions carefully, write your answer to each question in the space provided. If you need extra space, remember there are lined pages at the end of the book and you can use those to write in. Just indicate where you've done that. So on to question 1, and we're starting with a 5-mark question. So we've got Susan will soon start work in a nursery. She has attended an induction that covered personal hygiene instructions and security measures. Susan has also been given information about legislation that applies to her work in the nursery. So we've been given a case study here about Susan. Now the question has a command word, explain, and we know when we have an explain word we need to have a how and a why. Okay, so explain why Susan will have to follow the personal hygiene rules, no jewellery, and use correct hand washing routines whilst working in the nursery. So there are some general points that you can make about this, and then some more specific ones that must address the no jewellery and the no hand washing routines. To get the level 3, which is the 5 marks for this, there needs to be a detailed explanation of why we have personal hygiene rules, and then linked to jewellery and correct hand washing. And you must explicitly make that relevant to the nursery setting. So we need to be thinking about that in terms of the fact that we're working with early years and children. Okay, if you're in level 2 you might have covered jewellery and hand washing, but you're not going to have a balanced explanation for both, and level 1 is more likely to just be a list. So when we're talking here generally, well, why do we have good personal hygiene? So good personal hygiene prevents the transfer of bacteria. Bearing in mind that your skin, for every square centimetre of skin, you've got about 36,000 bacteria just sitting there quite happily, not doing anything wrong, until you've got an open wound, and then they become a bit of a problem. So we've got good personal hygiene prevents the transfer of bacteria. So it will ensure high levels of cleanliness, and leads to a reduced chance of illness whilst modelling good practice to the children. Let's get those children in there. So it also models good practice for the children and reduces the risk of illness. Okay, so we've given them some general points. I'm going to switch to a different colour to write the next bit. So let's think about the jewellery. Why don't we wear jewellery? Well, as we saw when we did the glow germ on our hands, there can be bacteria on the jewellery itself. So not wearing it in the first place removes places for the bacteria to grow or to get trapped. Why would we do that? Well, it depends what they're doing. We've got to link this back to the nursery setting, so they could be preparing or serving food, and in which case it could lead to contamination of the food. So let's bring that into it. So we can say jewellery may trap bacteria under it or on it, and this could be passed onto children's food during food preparation or handling of food at the nursery. Okay, so we've linked it back again. So we've given a point, we've given some evidence, we've explained it, we've linked it back to the setting. Let's have a different colour just to get our hand washing in there. So why do we do that? And as we said before, you've got this bacteria on your skin, so bacteria do accumulate on your skin. So bacteria will accumulate on the skin. So by correct hand washing, this can be destroyed. Okay, how's that going to benefit people? Well, that's going to reduce the spread of infection. So reduces the spread of infection. Okay, and again we're going to try and link that back again to the nursery, so within the nursery. Okay, so we've covered all three areas. That should be enough to get us level 3. Question B. So we've got identify, so that's our command word. We like those ones, they're just a sentence. One key aspect of the Data Protection Act, and give an example of how Susan could apply it in her work at the nursery. So we need to make sure that we are referring back to the nursery. So we've got to have the correct wording for the aspect of the Data Protection Act. Okay, so what could we have within a nursery? Well, we're thinking here more about children's records, aren't we, and having the information that we need. So I think security here could be a good one. So data should be secured. Okay, what does that mean? That means that non-authorised staff or visitors, people, cannot access children's personal information. Okay, that's our context, and then we need to say how we're going to make that happen. So locked filing cabinets, can't spell, would be used. Okay, where they're going to be used at the nursery. Treat them as daft, make sure you point out the obvious. Okay, question C. Identifying staff and receiving and monitoring visitors are two security measures within the nursery. Explain, so again we're looking at that how and the why, how these two security measures can protect individuals in a nursery. So we're looking to protect individuals at the nursery. Who are the individuals at the nursery? Well, that could be the staff, that could be the children, it could be visitors. So in terms of identifying staff, we've got to think, okay, how are we going to do that? So you've seen within school, we have our lanyards and our ID badges. Why do we have those? So that it's very quick to be able to spot and recognise who's a member of staff. For you guys, you see us every day, so you tend to know who we are, but it may be for a parent who's never met us before, or if we've got supply teachers in, it's about that being able to know that who's who. So we're going to put identifying staff. How do they protect individuals? So by wearing ID cards and staff lanyards. Children, parents and visitors can easily identify a member of staff. Okay. What's that in terms of why would we do that? Well, that is about safeguarding and being able to spot unauthorised people in the nursery. So this safeguards the children, as it makes it easy to spot unauthorised people in the nursery. Okay, receiving and monitoring visitors. So this is a point where we're looking at things like having CCTV on the entrances, knowing who's come in and out. So it might be that they have a buzzer to get in, that they have swipe cards so that staff can get in but visitors have to buzz in and out, signing in and out controls. It might be that we have visitor badges and lanyards so we can quickly identify who's a visitor and it's a different colour to the staff. So we need to write this down. So we're going to have buzzer entry on the doors, so only staff can enter without first signing in and getting a visitor's lanyard. And again, it's the same sort of reason here. This is so that we know. So this controls who enters and exits the building and keeps unauthorised, don't know what that's supposed to say, people out of the nursery. Okay, question 1 is completed. Okay, so on to question 2. And we've got another case study here in terms of it being an inspection report. So Thorpe GP surgery was recently inspected. The inspection report found medical records left lying around, vaccines not kept at the right temperature, medicines used to treat patients in the surgery were past their expiry date. Patients' electronic records were not kept up to date. No procedure for patients to give feedback or to complain. Information was not available in a range of formats, and access by steps was making entry hard for people with mobility problems. The inspectors also had serious concerns with the standards of infection control and cleanliness at the surgery, which included dust and cobwebs. So, doesn't sound like the sort of surgery you want to be attending. So we've got the question first, describe. So we know it's not a one-word answer. We've got to give some evidence to support us. How Thorpe GP surgery is not maintaining the rights of its patients. Give one example for each of the following headings. So we've been given 3 different rights here: protection from harm and abuse, consultation, and equal and fair treatment. And we have to make sure that what we write directly links back to the report on Thorpe GP surgery. So if we're looking at protection from abuse and harm, Well, we're looking for something within this report that may cause harm to a person. So, vaccines not kept at the right temperature and medicines used to treat patients past their expiry date. Both of those could make somebody really quite unwell. So we could put that down as protection from harm and abuse because it is a harm. So we could say we only need to give them one bit, let's see. So vaccines not kept at the right temperature may cause harm. Okay. In terms of consultation, the right to consultation is patients being able to discuss things, to talk to somebody about their conditions. Well, let's have a look. What have we got in here? Well, there's no procedure for patients to give feedback or to complain, and their records are not being kept up to date. So that means that it would be very difficult if they were to raise a complaint for them to evidence it, because they haven't got the information in the records to make that happen. So we can say here, no procedures in place for patients to feedback or complain. Okay, and the last one is equal and fair treatment. Well, here we're looking at things like the access issues. Oops, it's not a highlighter, put it in the right colour. So we've got access issues and we've got information not in a range of formats. So that really means that there's limited access for people with mobility issues, so we can say that. So limited access for those in wheelchairs due to the steps. Okay, and the fact that their information isn't in different formats means we're not looking at a diverse society and we're not making it accessible for all. So you could say info in what is not in a range of formats, so not accessible for all. Okay, right, question B, state. This one again, it's a little bit like identify, so when we state something we're just putting a sentence. So state 2 different ways that staff could maintain confidentiality at Thorpe GP surgery. So here we need to link our information back to the surgery. So you can't just write information should be locked up in filing cabinets, don't leave documents lying around. What information should be locked in the filing cabinet? What documents should not be left lying around? Who should not leave those documents lying around? So that's where we're sort of going with that. So we could say, number 1, let's have a different colour. Medical records must be stored securely. Okay, and that could be in a locked cabinet, or it could be electronic files password protected. So I'm going to put electronic files are secured by passwords. Okay, so remember we're looking at that need to know basis here, so therefore that's going to be my next point. So we're going to be info is shared on a need to know basis. Okay, so the staff aren't going to be going around gossiping about the patients. Okay, question C, and another of our long answer ones. This one again is 5 marks, and there are 3 level responses within this. Level 3 is 5 marks, Level 2 3 to 4, Level 1 1 to 2. And as we've found with most of these types of questions, they're looking for 2 or more effects, and in this case we're looking at physical and emotional effects. So we've also got to link those back to our values of care not being applied. So this is a pies question. Okay, remember, not apple pies. Physical, intellectual, emotional even, and social problems. So the inspectors found that the staff at Thorpe GP surgery are not applying the values of care. Describe physical and emotional effects on patients attending the surgery if the values of care have not been applied. So we've got to make sure we've talked about both. So first we need to give them an example, and then we need to give them an effect to go alongside it. So our first thing, if we refer back here, was medical records are left lying around. Well, that's breaching a value of care. So the value of care is maintaining confidentiality. So I'm going to tell them that first. So at a healthcare setting, the value of care maintaining confidentiality should be applied. At Thorpe surgery, patients' files are left lying around where anyone could access them. Okay, now I need to give an emotional and a physical effect for that. So patients may suffer ill health which gets worse as a physical effect of finding out their records were not kept confidential, and we can say why for that, and that's an emotional effect due to a loss of trust. Loss of trust. Who's that trust in? In the medical centre. Surgery. Okay, so that covers one of our points. Let's go for a second one. So what else were they doing that doesn't maintain a value of care? Well, one of those should be promoting equality and diversity, and we're not doing that if we've not got provision for disability. So we've got the value of care promoting equality and diversity is also not maintained as there is limited access for disabled people due to steps. Okay, so what sort of effect could that have physically? So physically, if patients cannot access the surgery, they may not get the treatment that they need, or they could fall and injure themselves trying to access the surgery. On an emotional level, how's that going to make people feel? It's going to make them feel frustrated, disempowered, it might make them feel a bit stressed or not even feeling safe. So this may make patients feel stressed and disempowered. Okay, we've got 2 different points there. That should be good. Okay, number 3. Triangle House is a social care organisation that provides advice and help for homeless adults. We've got some information here about Triangle House. So we've got facilities, wheelchair access, adapted toilets, computers and phones, access to interpreters. We've got the opening hours displayed, and we've got how we can help, finding accommodation, benefits advice, nurse available for health concerns, a free lunch, dietary needs catered for, e.g. vegetarian, vegan, halal, gluten-free, advice on looking for a job, support service for rough sleepers. We always look at the individual needs of our clients when deciding how best to support them. So they want us to identify 3 different ways that Triangle House is promoting equality. So what are they doing that means that they're providing access for all and treating everybody as a unique individual? Well, they've actually said that in the last sentence, but it's a bit obvious. Let's look at some of the other ones. So it tells us we have got, let's highlight it, adapted toilets, wheelchair access, considering individual needs when looking at how to support them. Free food is available so that they get lunch. We've got access to interpreters. Where have I put that? There. Okay, so we've got plenty of things that we can pick from. All we've got to do is state 3 of them. So I'm going to go wheelchair access, adapted toilets, and access to interpreters. Okay, give 2, so give, again it's just a statement, different examples of up-to-date information provided by Triangle House. Well, looking at information that they've given, we've got the opening hours. That stands out the most to me. But we're also telling them about different services that we've got. So we've got a nurse available. We've got support services for rough sleepers. We've got job seeking advice, benefits advice. We've got different facilities like the adapted toilets, and we've told them about the services so people know what to expect when they come to them. So I'm just going to pick 2, so I'm going with the obvious one. Opening hours. Okay, and a nurse available for health conditions. Two nice easy marks. Okay, over we go, and we've got another long answer question. So again, 5 marks, 5 being level 3, level 2 being 3 to 4, level 1 being 1 to 2. Explain how the up-to-date information provided by Triangle House supports the rights of individuals using its services. So we know we've got 5 rights. We've got choice, confidentiality, protection from abuse and harm, equal and fair treatment, and consultation. The up-to-date information we've got is the time service is open, the type of care that they provided, and what alternatives are available. So we need to link that back to the rights, and we also need to make it relevant to the context of the situation. So this is looking at Triangle House in itself. So and think about why. Why do we do that? How does that make people feel as an endpoint? So we're going to say individuals have 5 rights. Choice, consultation, confidentiality, equal and fair treatment, and protection from abuse and harm. So we've kind of introduced where we're going with this. So we can say Triangle House provides up-to-date info on its opening hours and types of care available. Okay, so now how do we say that supports their rights? So by showing the opening hours, service users know when they can access services and choose a convenient time to attend. Okay. They can also choose the type of care that they want. So they've got that there. So we're supporting the right to choice. So we've still got choosing a convenient time. Let's go for a different one. Let's go for consultation. So service users have the opportunity for consultation by speaking to a nurse for health issues or an advisor about job seeking and benefits. Okay, how's that going to make people feel? So individual rights being maintained empowers people. They do like that word, and they feel valued and treated fairly. Okay, 5 marks. On to section B. So, question 4, we've got carrying out risk assessments is one method of reducing risks and dangers in care settings. Name 2 different activities where methods for reducing risk should be used in the following care settings. So we're just naming, it's just like state or identify. So we've got a nursing home as a healthcare sector and a primary school as an early years. So I'm going to write next to it health, early years. Okay, so 2 different activities for reducing risk. So in a nursing home, it could be things like using a hoist. What do we use that for? We use a hoist to lift patients. Okay, so that reduces risk to the patient and to the member of staff. What about in the primary school? Well, they might have apparatus in the playground for them to climb on. So apparatus for climbing is regularly checked. Okay, part B. A primary school and a nursery are examples of early years settings. Identify 2 other examples of early years settings. And there's loads that we could write here. So anything like parent and toddler group, play school, preschool, sure start centres, breakfast clubs, after school clubs, as long as they're for the under 7s, daycare centres, childminder, creches, they are all appropriate examples. So I'm just going to put a range in here. I'm going to have a breakfast club for under 7s. I'm showing that I know that that's early years ages, and I'm going to have a preschool. Okay, a GP surgery is an example of a healthcare setting. Identify 2 other examples of healthcare settings. So, where do you go when you're not feeling well? It might be to your GP surgery, or it could be to a hospital. Okay, you're at the hospital and they decide that you need some medication, they may send you to a pharmacy. And of course there is an extensive list there as well, so things like a chiropodist, a clinic, a dentist, a drop-in centre, a health centre, a hospice, a medical centre, a mental health clinic, a mobile health screening unit, a nursing home, an optician and a podiatrist. Any that you can think of that have any relation to healthcare settings are appropriate. Okay, question C, we've been given a big table to fill in. So we've got complete the following table by stating the correct early years values of care for each example given. So we know there are 9 values of care in early years, and we have to give them the correct one for this. So a nursery teacher challenging a child who makes a sexist comment, that is practicing anti-discrimination. Okay. A primary class teacher providing a range of activities that are stimulating and interesting, that's encouraging children's learning and development. Okay, nursery staff using a child-centred approach to meet individual needs, that's putting the child first, so we know that that is known as the paramountcy principle, and it's phrased as ensuring the welfare of the child is paramount. Okay. A teacher sharing information about a child with a social worker, well, that's part of that wider multidisciplinary team, so that is working with others. And the last one, all electrical equipment in a nursery is tested regularly. Cleaners ensure a high standard of general cleanliness, and that is the keeping children safe and maintaining a healthy environment. So keeping children safe and maintaining a healthy environment. And it's important that we get the terminology correct in those, because they won't give you the marks if you don't get those marks in there. Okay, and I believe we are nearly at the end. So question 5A, explain how care workers provide advocacy and can help to support an individual's rights. Okay, so we know that advocates speak on behalf of or for individuals who are unable to do so themselves, but they don't give their own views, they give the views of the individual. Okay, so we're going to tell them that first, because we need our how and our whys in here, but we're going to open with what is an advocate. So advocates speak on behalf of individuals who are unable to do so for themselves. So that may mean that you've got a young child or somebody with learning difficulties or conditions like dementia, or who's had a stroke, or who has a mental health condition. That's going to stop them from necessarily being able to express themselves all the time. So by doing this, they're going to make sure that the individual's rights and needs are going to be recognised. So we're going to put that on. This ensures individuals' rights and needs are maintained. Okay, now we need to go into at least 2 ways that advocacy is going to support the individual. So we've got one there, it's a way that they help. How else could advocacy help them? So advocacy is going to support individuals and enable them. So it might be about them taking control of their care plan, about them feeling empowered from that, having their needs met. So it could be, and we'll give them an example, a social worker representing an individual with dementia, speaking about needs when a care plan is being discussed. So we're going to write that in. So advocates such as a social worker may represent a service user with dementia in the discussion of their care plan. Okay, that's giving them an idea about what we're doing there. In terms of that, how's that going to support their rights? What right are we giving them then? Well, we're giving them that right to consultation, even though they cannot speak, and also a right to choice. So we can say this supports their right to choice and consultation. It will empower them to be part of their decision-making team. Okay. So to get the full 8 marks on this, we're looking for detailed explanations, 2 ways that advocacy supports individuals, excuse me, and explicit links to the information supporting their rights. We've used the right terminology, and we've got in there the role of the advocate. That's 8 marks. Doesn't have to be a great deal, it just has to have the right information in there. Okay, on to the last question. So, for question 5b, key aspects of current legislation are listed in the table below. Match each key aspect to the correct piece of legislation numbered 1 to 4. So we've got the Children's Act, the Equality Act, the Health and Safety at Work Act, and the Mental Health Act. And all we have to do is put a number in the box. So, provides the authority to take the person to a place of safety for assessment. That's number 4. That's the Mental Health Act. Encourages partnership working and sharing of information between agencies. Well, that's number 1. That's the Children's Act. That's about different agencies working together for the rights of the child. Protects vulnerable people who are unable to make their own decisions. That again is the Mental Health Act. Protects individuals from discrimination on the basis of 9 protected characteristics. The minute they start mentioning discrimination and protected characteristics, you know you're looking at the Equality Act, number 2. People must take care of themselves and others in the workplace. That's Health and Safety at Work Act, good old HSOR. Aims to protect those at risk to themselves or others. That's the Mental Health Act. And prohibits both direct and indirect discrimination, harassment and victimisation. Well, there we're looking again, discriminatory side, we're looking at equality. So that's number 2. We've made it to page 11 of the paper. There is a spare page on the back. Remember, if you've got an excess that you need to write for your question, put the question number on the back before you continue writing, and just make reference during the text so that they know to look at the back for you as well and don't miss it. Good luck in the January exams. I hope this has been helpful to you.